want to take you to Queensland, where an unprecedented outbreak of melioidosis has claimed 5 more lives, taking the state's toll to 12 this year. Straight to our Brisbane reporter Ariana Levy, who's here to explain it all for us. Ari, this is extremely worrying. Take us through how many people have died and what is this disease?
Yeah, good morning, Bridget. The numbers are incredibly alarming for health authorities. Now, as you mentioned, there have been 5 confirmed deaths by the Cairns and Hinterland Health Service overnight, which means that there has been a total of 9 bacterial-related deaths in the region, and coupled with an additional 3 deaths in Townsville, that brings the total number across the entire state to 12. Now, melioidosis is a rare bacterial soil-borne disease. It usually occurs in the aftermath of flooding events and even during the wet season, and the infection usually can enter the body through either cuts or wounds. Often it can even be entered through breathing it in, as well as sort of drinking contaminated water. Now, the Tropical Health Service has said that there has been a record-breaking number of cases this year, with the reason as to why cases have nearly tripled still very much being investigated. But so far, the indication is that the recent wet weather that's been experienced in the far north has been a major contributing factor. Now, older people and those with compromised immunities are usually most at risk of contracting the disease, and it has been confirmed that the 90 other positive cases across the state of those with the disease, most of those patients have contracted it through sort of breathing the bacteria in. So again, health services are really urging and pushing that message forward to locals to make sure they protect themselves when it comes to getting in contact with soil, to wear masks if you're using a high pressure hose, making sure to cover up and wrap up any sort of cuts and abrasions on the body. And as always, if you have a cough or have difficulty breathing, to make sure you present to the GP or emergency department. Doctors are really saying that this disease is quite serious and it can become progressive very quickly. So very concerning indeed, Bridget.